In Gibraltar, we actually have 7 beds in assisted living. We have 5 beds in Sandpits, and we have 2 beds in Kent House. We feel that those aren't enough, that we need more beds. Possibly, well, we don't know exactly how many because we don't have data as to how many service users are actually living on their own. We are talking principally on the basis of those people that we know. And that we know, yes, they live on their own. They get some support from carers. Perhaps they get a visit in the morning, half an hour, maybe half an hour later on. But the rest of the time they're on their own, and we don't think that this is allowing them to live the best quality of life that they could live.
We know you have an open conversation with many users, with many sufferers. What's brought it to your attention now that you need this? Why now?
In fact, Kevin, I was looking back at notes the other day, minutes from the Mental Welfare Society. We were already talking about the need for sheltered accommodation in 1985, so we're going back a long way. It hasn't necessarily been sustained as it should have been, but we've been aware of this need for many, many years. The reason why we launched yesterday was, well, because this week was Mental Health Day. Because we are very aware of certain people living in the community that really had issues. There was one in the video we showed yesterday. There was one reference to a particular service user who, since the video was made, is now in care, in assisted living, and their life is much, much better than it was before.
And what are some of the problems patients encounter when they're discharged into the community?
Well, I think, as I say, I think now it's done much better than it was in the past. I think in the past people were just discharged and that was it. They were given a bed sit somewhere and pretty much they had to get on with life on their own. Now, as I say, there is more help. Somebody who does get about an hour in the morning and gets an hour or half an hour in the evening, but the rest of the time, that's it. And that this person has issues with doing things for themselves and so on. And they have said it to me quite often, yes, that ideally they would like to live in a place where they had their own bed sit, but that then they could have a communal area, that they could go and talk to somebody, that they sometimes don't feel very safe because they live on a first floor, on a ground floor.
How is the society in terms of its open conversation with the GHA, specifically with the mental health team? Is that happening? Are you talking? Are you engaging? Are you being heard?
We do have some meetings. We have had some meetings with the new mental health team. Unfortunately, none of them came to the launch yesterday. Though they were invited, but they didn't come. There is some conversation. There is some conversation with them, and if we ask for a meeting, we'll be given a meeting. There's no problem with that. I think that sometimes there might be some resentment as to the kind of things we come out with publicly. But I think that is a role. As an NGO, we have to keep on bringing things out into the public. It's not just a question of working with the GHA behind the scenes. You know, that is not our role. We're happy to do that too. We're happy to cooperate or to support initiatives that we agree with, but we also have to keep having the public focus, and I think that sometimes that doesn't go down very well.